How are you?
Hi, buddy. Good. So this is Jake. This is Jake. Hi, Jake. You are a big boy. All right. So I was just reading through the records from your recent visit over at the SPCA, and the pathology report and the samples that were taken from this shoulder mass and from the mass that's kind of up here in the front area, right?
Yep, that's right.
Okay. And that's basically all the testing that's been done as of right now, right? No blood work, no x-rays, or anything like that?
I don't think we had blood work. We didn't have it at SPCA, that's for sure, but we may have had it at Irving.
Yeah.
Did you guys get records from Irving Pet Hospital too?
Don't think so.
Okay.
Looks like you were there like 3 months ago. Or something
Yeah,
like that.
November, December,
okay.
so a little bit longer.
Okay.
We had this lump aspirated there, and the doctor came back and said it's just a fatty corpuscle. Then the lump on his shoulder, he's had that for at least 5 or 6 years, but it was tiny.
Okay.
And every single time I've been in to see people about it, they've always told me, again, fatty corpuscle, leave it alone.
Yeah.
We came in to see Dr. Vitale when he was here, and he said the same thing.
Huh.
And up until recently, that's all we thought it was.
Sure.
Even when it was growing, they just kept telling us it's fine.
Right. And then it really started to grow recently, right?
Well, last year, yeah, it's really gotten big.
Okay.
And then the one on his shoulder here has been 6 months or a year.
Okay.
Yeah, that one was just recently noticed.
Yeah.
Okay, I'm gonna feel that one again real quick, buddy.
Oh.
Can I feel it again?
If you need me to help you stand him up or whatever.
No, that's fine. Let's see. Actually, can you stand up? Come here. Come here. What a good boy. What a good boy.
Yeah, I'm trying to give you kisses. Sorry.
No,
stay, Jake.
No, it's good. Okay, so it's this big mass right here.
Yeah.
Okay. All right. And he has a few other masses too they sampled, but we're gonna focus on these two because they're the ones that we know are something not good, unfortunately.
Yeah.
So they sent it in, and the pathologist looks at those samples, and it's a small sample. You know, it's just a needle sample.
Yeah.
And they said, we can tell this is cancer. So what they called it is malignant neoplasia.
I saw that.
So the word neoplasia just means cancer in
Yeah.
general, benign or malignant. And then the malignant part means this is an aggressive cancer.
Yeah, it could be spreading.
And the cells look the same on the mass on the shoulder or the arm
Okay.
as they do in this big mass here. So what I think may be going on is that this is potentially the primary tumor,
Okay.
and it has spread to a lymph node that's in this region. There is a lymph node that's here. It's called a prescapular lymph node or cervical lymph node.
Okay.
And that is generally the location that it would be located, and it would drain this area of this front leg.
Okay.
The way lymph nodes work is they kind of drain excess fluid, and it goes up into the lymph node, and the lymph node then puts it into the lymphatics, and then it puts it back into the circulation.
Okay.
And so cancer tends to spread to 2 different places in the body. Lymph nodes, so like women with breast cancer and stuff like that, we're always interested in the lymph nodes. And then the lungs is another common place.
Okay.
So that's what I think might be going on. I don't know for sure yet. That's what I'm suspicious of.
Okay.
Because the cells look very, very similar.
Now they had said, I know this is probably an off the wall thing. They had said in there that the slide could be contaminated from another patient, possibly, and at least in the report that we got. And I just was curious to know why that could be.
I think it's towards the middle. Right?
Yeah, it was in all the notes of it.
Right, yeah. Oh, yeah. So what they're saying is that there's all these cancer cells, and they said in one slide, there are some areas that contain a lot of mast cells, which are inflammatory cells.
Okay.
And they said this slide also contains areas with populations that are similar to those seen in the other slides, which are the cancer cells.
Gotcha.
And they said the significance of the mast cells is not clear. And I think they're just trying to come up with an explanation. They said, given that they are in only one slide and only in some areas, they could possibly represent contamination. For example, this slide may have been used to smear a specimen from a different patient just because they didn't see it anywhere else. So
Okay.
I don't think it changes things too much. It could just be that they hit an inflamed area of it or something along those lines.
Gotcha.
But the cancer cells were in all of the slides, so I don't think that's likely to have been a mistake necessarily.
Okay. Well, I just figured I would double check.
Of course, yeah. I've never seen them write something like that. It's a little bit interesting.
Ditto, yeah. I was surprised they did.
Yeah.
We have-
So, I mean, how do we go about, is there a way of treating it? I mean,
Right. So whatever this thing is, it appears to be kind of like a solid mass, right? Like it's
Yeah.
a mass that's been growing there on the skin. You can see it, and it has kind of defined borders to it.
Yep.
Though it may have kind of like a stalk going down below it. So usually, if it was just that, we would think about removing it surgically.
Okay.
Doing surgery to remove it. That's the treatment of choice for most solid tumors in dogs, is trying to get rid of it surgically and then figuring out what else to do from there.
Okay.
If the thing that is up here is truly a lymph node that has spread in it,
Yeah.
that really starts to call into question whether doing a big surgery is worthwhile or not. We
Okay.
could think about trying to remove both of them.
Yeah.
So what we call cytoreducing, or trying to get down to the least amount of cancer as possible.
Yeah.
We could try that. I'm not exactly sure how removable this thing is. We have to get a surgery consult and see what they think about it.
Okay.
They might think about something like a CT scan to kind of give you an
That's-
idea of the area.
That's
and,
what they were talking
yeah,
about.
and tell us, how likely do we think it is that we really can get rid of this thing. If we can get rid of that mass and that big mass, that's a good first step.
Yeah.
But I don't think it's going to fix the problem entirely.
Okay.
I'm worried that we still have cancer beyond that, so we might not be able to get all of it at either site. And the fact that this thing could represent a lymph node tells me that there could be cancer cells that are out and about other places in the body.
Okay.
So before we do anything, I think, we can do one of two things. I do want to evaluate the lungs.
Okay.
So the easiest way to do that is a set of chest x-rays, which we could do today. If we're thinking about going forward with a CT,
Yeah.
then we could do a CT of the chest, which is actually a little bit more specific. It's just that it's a little bit bigger jump because he has to be anesthetized for a CT, and a CT is expensive.
Gotcha.
So if there's something in there that's obvious, it's a little hard to say, oh yeah, let's just go do the CT, where if we do the less expensive, less invasive x-rays, we might get information that would say,
Yeah.
oh, maybe the CT and the surgery aren't worth it. Because if they're spread into the lungs, then surgery basically is off the board. Because
Okay.
we can't remove stuff that's spread to the lungs
I
very
understand
easily
that.
or at all. If it's in a lymph node, that's a little bit more of a gray zone where you can sometimes remove it. It's still hard to make that decision, because if you have an aggressive cancer that is spreading around the body, the surgery is only going to help us so much. We would think about doing chemotherapy or something like that afterwards.
I understand that.
The other challenging thing right now is that I don't have a definitive diagnosis. I know this is some kind of bad cancer that is potentially spreading, but they couldn't tell what kind of cancer it was from what we gave them. And that's because A, it's a small sample, but also the cells look pretty abnormal, which means they can't, the pathologist can't define exactly what it is.
So then, does that mean you just don't know exactly
That
where
means
to
I don't, right
treat?
now, I don't know what kind of chemo we would treat with. Like I said, most of the time we would treat with surgery, so that's
Yeah.
something that I think is probably reasonable. But yeah, I don't know what kind of chemo I would treat with. I don't know how effective that chemo would be, because I just don't have a definitive diagnosis right now.
Okay.
So imaging the lungs is important. Like I said, we could start out with the x-rays, or if you want to skip to the CT, we could do that, and the CT is the lungs as well as the neck and shoulder area.
So, I mean, I guess we should get quotes on both and
Yeah.
just see what makes the best sense to do.
The x-rays are about $350.
Okay.
Doing a CT is about $2,500. So it's way
Nice.
expensive. Yeah.
Okay.
So that's why the x-rays
Yeah.
are a bit easier to make a decision on, because they're cheaper, and we can just do them today. She doesn't need to be anesthetized or sedated or anything probably.
So let me ask you, if we do those today and it doesn't show anything in the lungs, is the next step a CT? Do they have to do a
Yeah,
CT?
so they don't have to do a CT.
Okay.
It would probably, I can let you talk to the surgeons about that more, because it's going to be more for them to be able to plan what they're doing.
I understand that.
Yeah, so it's gonna, if we do the CT, it's gonna give us more information about the masses, about what the best types of surgery are gonna be. Sometimes it gives us information that makes us feel like, oh, hey, you know what, I don't know if surgery is actually gonna be possible or
Gives us
worthwhile.
an answer.
No, I
Yeah,
understand
yeah. There is kind of an intermediate step that we can think about, which would be biopsying them. So taking a bigger sample than what was taken.
that. That's what they were supposed to do there, because for the first time they had just aspirated it on the spot,
That's when we thought it
and
was
that
benign.
wasn't enough.
Yeah.
Well, no, this was the same time.
Oh, okay.
They knew it wasn't benign, but
Right.
she did it. She's like, I can't tell, so I think we should do a biopsy, and that's
Ah.
what they sent out to get that.
Supposedly.
Supposedly, yeah. Because
But
we,
they didn't take pieces of it, right?
No.
I don't think so, but
There'd
they
be holes in it if we did.
Yeah.
charged us twice.
Nah.
Go figure.
Yeah, so we could just take pieces of it, and that would maybe give us a better idea of what exactly it is.
Question for you?
Of course.
Just, sorry, about the
You're fine.
piece. The vet was telling us that the bump,
Mm-hmm.
we're so nervous about him bumping it. Is it possible that that can break?
Yeah, so
Yeah,
you
she
can
talked
tell
about
you can
dehiscing.
tell the skin over the mass is starting to get kind of thin.
It is.
That's what happens sometimes as masses grow, they expand and they start to invade into the skin and they can break through the skin and you can get this kind of ulcerated open wound kind of thing. And
Yeah.
it will not heal in general. So anything that, if he's like lying on it or something like
I've been
that.
trying to get him not to, but
Yeah,
he
so
does.
make sure there's padding under him, try and get him to lay on the other side if you can, because that thing could open up. So,
Okay.
and that could be a limiting factor for him over time. If it becomes infected, he's wanting to lick and chew at it and stuff,
Oh, yeah.
it becomes a big problem, unfortunately.
So when you go to biopsy that, that's not gonna make a,
No, it can.
Okay.
It could create, because I'm gonna poke a hole into it basically.
right,
Yeah.
which they've already
They've
been
already
doing.
did that.
Right, and
yeah.
I'm gonna make a bigger one, like I'm gonna
Right.
make one like this big.
Right.
They've
Okay.
just been doing small needle ones.
Yeah.
So it does worry me a little bit that, yeah, if we poke a big hole into it, I could
That's
kind
my
of,
biggest fear.
speed that process up, but that's the only way that we have to get an answer really. So
And so if we biopsy it, is that going to have a definitive result, or could it come back literally?
it
the
could
same
come back
as
a little
that?
ambiguous like this, and sometimes there's extra stains that we want to do, which costs extra money, of course.
Of course.
And sometimes there are cancers where we just can't tell what it is. It's not very common. Usually we can get pretty close to an answer if we get a good sample and do extra tests and stuff on it.
Okay.
So, in him, I think what makes the most sense would be to say, well, let's do some chest x-rays. Just get an idea of, okay, is there anything in the lungs? Because if there is, then we really are going to have to change the gears a little bit
I
here.
understand that.
So we can start there, and then if there's nothing in the lungs, then we really do have to kind of think about things a little bit. And I think having you guys meet with a surgeon might not be a bad idea.
Okay.
So they can feel this stuff and tell you, hey, I think there's a surgery that's reasonable. Talk about the CT along with the surgery. You can do them at the same time.
And obviously, I'm sure with surgery, like the sooner the better, because obviously they're continuing to grow. Yeah.
Yeah.
So that's why we're trying to get it done as quick as
Yeah.
possible if we
Yeah.
can.
And I would say let's do some blood work, just because even if he had some 3 months ago, I'd rather have some.
Well,
now.
they're going to do it before they do surgery.
Yeah,
right?
Exactly,
Okay.
exactly.
Yeah.
So I think today it makes sense to do chest x-rays and some blood work.
Okay.
And then if those things look good, then have you come back and meet with the surgeons and talk to them about what they think the options are. And then if we decide surgery is not a good option, or we decide we do want to do a biopsy first, either they or I can do the biopsy.
Okay.
If we feel like we want to kind of go for it and see what we can get surgically, and then kind of figure out where to go after the surgery with chemo or whatever else we want to do.
Yeah.
Then we could do that too.
Okay.
Okay.
All right. I think that sounds like
Is that
a good
something a
plan.
reasonable plan?
Yeah. Yeah. I think
Okay.
we should do that.
I have to be a little bit guarded about his prognosis because, usually when they can't tell what kind of cancer it is, that's not necessarily a good sign. That doesn't usually mean that it's not, that it's, less aggressive. It usually means that it's more aggressive.
Okay.
Otherwise, if it was less aggressive, we'd probably be able to tell the cells were they look a little bit more normal. These just look so abnormal, and that usually goes along with more aggressive cancer.
They want to hear that.
I know, I'm sorry, I'm
Don't
sorry.
tell me that.
And
They
if
said that-
this truly is spread, that also, obviously.
Oh, that's
this
factor.
thing's moving.
Absolutely.
Yeah.
No, that's why we want to get it taken care of as soon as
But,
possible.
we gotta get some more information, and then, we kind of just approach these things trying to do the best we can. So, making choices that help improve his quality of life and help give him more time, as much as
Absolutely.
you guys want to. We never want to do anything that's gonna harm him, obviously.
No,
but-
of course
But we
not.
are talking about doing big stuff like surgery and chemo. We'll talk much more about chemo as we get down the line.
I mean,
figure out
it-
what we're gonna use, if we're gonna use it.
And if the prognosis looks better, we're willing to go through those things.
Mhm.
If it doesn't, then it doesn't
Yeah.
make sense to do
Okay.
so.
I just want him happy and healthy like he is now.
Yeah.
Yeah.
On that subject, I just wanted to ask you, he looks fine.
Right,
Yeah.
why does he look so fine?
He's been
Right.
acting completely normal.
And that's a
eating,
little
of
tricky.
course.
So there is this period of time where dogs do look fine when they have cancer because they don't have the misfortune of knowing what's going on.
Yeah.
He has no idea what's happening to him. And there is a period of time where cancer, even if it's spreading, even if it's an aggressive cancer, doesn't necessarily make you feel bad. It's there. And us as humans, we know it's there. We have the subconscious, we have this
We know
conscious,
it,
and
yeah.
think about it and all this stuff. But they are just like, it's there. Maybe it doesn't feel quite normal, but he's like, I'm okay. I'll just keep going doing my normal thing. At some point, it gets to some kind of threshold. It
Yeah.
gets to some level where he's just like, okay, now something's wrong.
Yeah,
And it's not that it's not that it was fine before that. It's just that he was okay with it, basically. And so that's why right now he feels fine. But that's a good place for him to be in because it makes it easier on us to treat him.
Yeah.
If he was already sick with this, then we'd be really in a tough spot, and it'd be much, much harder to treat him. We'd have an even worse prognosis, that kind of stuff.
Absolutely.
So-
I frankly, I wanted to have this mask taken off from the beginning, but they kept telling me don't do it.
We've consulted
So-
so many
No,
doctors.
that's gotta be so frustrating. I'm
It
so
is.
sorry that
It's
this
just,
happened.
we've
but-
always had that, you know.
And I would have started
intuition.
treatment for this one back in November, but they
Right.
literally aspirated, and he apparently they said it was surrounded by fatty tissue. Yeah.
Yeah,
And
so.
you really get deep enough.
And it was not.
Yeah, and so I wonder if maybe this was a very low-grade tumor at first, and then something in it mutated and went kind of bonkers over the last.
Does
several
that
months.
happen?
Yeah, that can happen. As tumors sit around, cancer cells are unstable,
Yeah.
and they can mutate a lot more than regular cells can. And sometimes they'll mutate in a way that it gives them, this more aggressive activity.
Okay.
And then all of a sudden it's like, bloop, and then those cells start dividing, and all of a sudden the tumor is much more aggressive than it was before. So that can happen, unfortunately, and that might have been what happened here.
Okay.
Okay, well, let me just have my technicians come up with a treatment plan that goes over the cost of the consult today.
Yep, and the chest
the
X-rays.
blood work and the chest x-rays.
Okay.
Okay?
All right, sounds good.
And we can get the chest x-rays, it probably wouldn't take us very long, they're probably only need like half an hour or so to get the
Okay.
x-rays done. We can get the samples, and then what I do is I'll look at the x-rays and give you my initial interpretation, and then I always have a radiologist look at them just to make sure there's
Yeah.
anything subtle that I'm not picking up.
Okay,
And
great.
then I have the blood work back tomorrow, and I can give you a call with that.
That'd be awesome. We're also having a consult, at least over the phone, with a VCA vet in San Diego
Oh,
that we've dealt
Because
with
his mom is
before.
like, you need to talk to her.
Yeah, I mean, she's treated a lot of her pets for cancer over
Is
the
she a
time.
general vet or?
I think she's a specialist.
She's an
She works at the
oncologist.
VCA. Yeah, I think she's an
Do you happen to know her
oncologist.
name?
Sarah Ford.
Ford. That rings a bell, but I
She-
don't know her.
Yeah, it's
she's
in
based
San
in downtown San
Diego.
Diego. So anyway, we've been sending all the records down.
Okay.
We're gonna have one phone consult later this week or
Perfect, we can
the
get this
next
stuff to
week.
you guys and you can send that down to her as well.
That'd be awesome.
Yeah,
Cool.
like I said, I mean.
It's always good to have a second opinion.
Yeah,
you know,
and
or
everybody's
not that I don't
opinions
trust
will
you.
differ a little bit, and like I
Of
said,
course.
I'm a little borderline because this mass is pretty big about how good of an option surgery is, but it's
I
kind of the
understand that.
key to being able to treat him aggressively, and so we should at least think about it.
Can they possibly shrink it enough to take it out with chemo?
Maybe, we'd have to do the biopsy to figure out
And
exactly
see
what
what
it
it
is
is.
first.
Yeah. Or
Yeah.
even if that's worth it.
Yeah, that's
Yeah,
a possibility.
exactly.
Yeah.
Because some tumors we will see some shrinkage with chemo, and sometimes we don't expect to get that much shrinkage, and so it might not.
It might not be worth it.
Yeah.
Okay. No, I understand that.
Okay.
Okay.
Well, one of the technicians will be in just a few minutes. They'll go
Okay.
over that treatment plan with you. As long as that looks good, we'll get going on everything.
Okay.
Okay?
Sounds good. Thank you very much.
Yeah, do you have another question?
No.
Okay.
That's good.
Perfect.
Thank you.
You're
Thank you so
welcome.
much.
Stay good.
You stay there, buddy.
She's like, I won't.
I'm exploring.